Hello and welcome. My name is Reginald Andre, and I am your host. And today we have a good one for you. Actually, one of our listeners sent this in. And in today's cybersecurity podcast, we're going to be talking, unfortunately, about a sad topic, about a critical issue that has really rocked the state of Florida. And it's the data breach involving the Department of Health, the Florida Department of Health. Unfortunately, thousands of sensitive health records of Floridians were seized by hackers and released on the dark web. And in today's episodes, we are going to break down what happened, the implementations, and what we can learn from this incident because our podcast is all about making sure that you, the business owner, are is protected. So let's start with a recap of the event. So we've just learned just about an hour ago. Right now, it's July the 12th at 5:40 p.m. And we learned just an hour ago that recently 20,000 files containing highly sensitive information was compromised from the Florida Department of Health website. This stolen data includes HIV test results, detailed doctor notes, immunization records, and various virus testing records. This breach has been exposed and it has exposed some of the most private aspects of us Floridians' lives. And being from Miami, Florida, this is really touching to me because it really sucks when I have to report about, about something that's happening here in my home state. So in addition to the HIV test result, we have a lot of what they call PII information, which is name, date of birth, address, social security numbers, and insurance information. And of course, we also have detailed medical records such as lab results, signed medical release forms, workman's comp records, and COVID 19 diagnosis. So even there are reports that they have photos of passports and mammogram results. So, I mean, this is really, really a bad thing that's happened here. So, let's first talk about the implications of this breach. First and foremost, obviously, we're talking about significant privacy concerns. Obviously, HIV is going to probably be the biggest one, right? This violation of someone's personal privacy is really, really bad. The potential for misuse of this information is through the roof because someone with that's affected by this, then now increased risk of identity theft, financial fraud, because now their social security is out there. We've even seen in the past, we talked about this before, where hackers were using some of these results to say, look, we are going to now expose your results, whatever medical records they have, to the world if you don't pay us a ransom. So what they do now is not only they try to go after the person that they hacked, in this case the state, they actually also go after the actual user or the victim as well, the end person that's doing that. So in response to this breach, the Florida Department of Health has stated that they will notify all affected individuals. So all 20,000 people will be notified. But now let's talk about the hacker group that's responsible for this attack. It's called the Ransom Hub, and these ransomware groups, they're not here locally. They're international. They're Russia, China, North Korea. And what they wanted to do is that they wanted the state of Florida to pay an undisclosed sum of money. And what they're basically saying here is that they're saying, hey, look, state of Florida, Department of Health, we hacked one of your systems. And if you pay us, we'll act like this never happened. We'll go ahead and just kind of like, hey, we got your information. We're going to go ahead and put it in the trash, and we promise we're never going to do anything. However, the state of Florida has a policy, and this is actually a policy for all of the departments within the state, all of the municipalities, the counties, anything government related to the state of Florida. They have a policy that says that they have a firm policy against paying any ransom to cyber criminals. And this is interesting because in my podcast that I have on every Tuesday, called the Security Squawk. So check that out. I'm with two other people, Brian Hornick and Randy Bryan. we actually just talked about that. We actually talked about should there be a ban? And this was actually the CISO director talking about there should never be a ban on ransomware. And you know what? This is actually a good reason why you shouldn't have these type of bans because of course the state of Florida had the money to pay, right? These ransomware guys, they probably wanted a million, two, $3 million. So of course they had the money to pay. However, because of the policy by the government, by the state of Florida, they said that, hey, it doesn't matter what they cause, what they have, it doesn't matter. So their reasoning behind that is several factors. Well, let's go quickly over that. First of all, if you do pay the bad guy, you're basically encouraging future attacks, right? Because you pay them that $1 or $2 million, and what's going to happen? They're going to be greedy. They're going to be, hey, this is where the money is here. All that we did is hack this system within a couple of days, and we showed them we had the information, and they paid us $1 million. Who makes that type of money? And then now, future attacks. Also, there's no guarantee. So there is to some defense, there is a chance. I think it's 3 out of the 10 times, so about 30% chance that even though the person who got hacked pays the money, that the hacker either doesn't keep their promise and they still release the information. So meaning they got paid, but they still go ahead and say, you know what, we're going to try to make some more money from this, right? So there's no guarantee that they won't release it anyways. And of course, you're funding criminal activities. If you do pay them, you're basically now kind of going back to future tax, but you're also helping these criminals stay afloat. And obviously that's not good. So in this case, Ransom Hub, they released the files on their website on the dark web last week, but now it's public records that it's out there. And just in case you don't know what the dark web is, the dark web is a place like another layer of the internet where it's not easily accessible to the general public. And this is where the bad guys go to play. They're selling this type of information, sensitive information. There's human trafficking happening out there, guns being sold, all of this being on a different layer of the internet. And from there, they're doing all of these illegal activities. And to give you an idea, the layer of internet that me and you use, which is the regular Google and Microsoft and stuff like that, the dark web has more activity there than the regular internet. So that should now give you an idea of how big the dark web is. So, I mean, in my opinion, this is probably going to be one of the worst data breaches in Florida history as far as the government. It's far more extensive. Last week we talked about it on our podcast about the Department of Health having some type of compromise. But now that they're saying, hey, not only did we have a compromise, because there's one thing to get hacked, but there's another thing that they have your information and they released it on the dark web. So what can you do if the state of Florida Department of Health contacts you? Well, first thing that you're going to want to do is you're going to go ahead and guard your personal information, and that's by going to the credit bureau. Now, typically when this happens, they give you 1 year credit monitoring. I mean, really, what's 1 year? It should be lifetime, in my opinion, because you do 1 year, what happens? Your social security number stays the same, your address, your phone number, all of that information stays the same. So they just gave you a $30 voucher to go use it at some credit bureau. No, it should be lifetime. But nevertheless, lock your social security number. That way, if someone is trying to use it, it's going to be blocked, and there's another layer of security from that. And then if you're a business, this is the importance, and this is why we do this podcast. You have to have a robust cybersecurity measure. You got to conduct regular security audits. You got to see where this sensitive information is. You got to encrypt it. You got to store it securely because, I mean, for these hackers, in a way, to have an Excel spreadsheet of 20,000 people and it has their name, email address, social security number, HIV, yes or no, mammogram, COVID-19, yes or no, like all of this stuff, somebody dropped the ball in the state. I don't know the details. So I'm not going to speculate how the hackers got in, but typically it's not what you see in the movies of them doing all this crazy coding and these little funny things that gets them into the system. It's someone not doing their job on the the side of who got hacked. It's an update that didn't happen. It could be someone clicked on an email. It can be someone sent something. I mean, it could be them using an old system. There's so many different things, but it's usually the hacker, and he's just trying to see what's out there, and they just, oh wow, look at this, a treasure trove. So this is going to be interesting. This is why you should have a multi-layer security strategy. Always continue to monitor your data. Have an incident response plan so that you can mitigate these type of breaches. And for the government, I mean, hey, I'm Florida, right? I'm waving the flag. I'm all about Florida, but unfortunately, this is a big shame on you with Florida. We should be doing better in protecting people's information, especially the stuff like HIV. That's so important. I mean, that's someone's personal information, and you just don't want that out there, right? Maybe you haven't disclosed it, and that's that person's prerogative, and that's that person's business. But the last thing they're going to want to do now is to be able to Google their name one day and see that this health file is out there, and their business is on the street. So it's really not it's really not right. So for those affected by this breach, definitely contact the state of Florida, or if you think you are, I would also just contact them, because it seems that it was certain people going through the agency for certain things, so, or using their services. If you went to your doctor, unless it is some topics, they don't just send stuff to the state. There's certain things that trigger that, so you may just want to go ahead and reach out to the state of Florida and see if your information is there. So to wrap up, this incident, underscores the critical need for robust cybersecurity measures in protecting sensitive healthcare information and just information in general. A lot of times, I get my clients telling me like, "Hey, we're just holding such and such information. Who cares about this, right? Who cares about, we're a car dealership. Who cares if someone has an inventory of all our cars? Who cares if they just have the name of our clients?" But guess what? The Florida Department of Health, they're going to get through this. In a year from now, no one's going to be talking about this on the mainstream media. Why? Because they have something called taxpayers. And taxpayers will continue paying taxes and will continue funding, those employees for the government. But you, as a business owner, you have something called customers, and they vote with their dollars, and they can vote to go to you, or they can vote to go to someone else. And I can guarantee you, if you are a business and you now have to tell your customers, "Hey, I wasn't properly holding the information that you gave us as far as the sensitive information, like if you needed if you're a car dealership and now you have to get their social security number, or you have to now get their driver license or picture of their driver license, even their bank records, and now you have to tell your client that this information is lost." Tell me if they continue to do business with you. They're going to vote with their dollars. So thank you for tuning in today's episode. Don't forget to subscribe and stay tuned for our next episode. Right now, we are streaming on our YouTube channel, where we're at 319 subscribers. So hit that like button. Let's get that to go up. And then I'm also streaming on my personal Facebook page and also on my LinkedIn page. So please go ahead and follow me there. Let me know that you appreciate this video, and we'll see you next time. All right, take care. Bye-bye.